Hello everyone, hopefully everyone is doing well and is safe at home or wherever you are watching this program. COVID has affected every aspect of our lives today. It has affected our social lives. It has affected the ways in how we do business. It has even affected our religious lives and how we worship our God. Today I will be talking about COVID, and this is my outline. I will be asking what is COVID, how to prevent it, ways to strengthen the immune system, the symptoms of COVID, what to do if you are sick, and why are there COVID outbreaks in the US currently. My sources for today are the World Health Organization, the CDC or the Centers for Disease Control and Prevention, Harvard Health, and also the BBC. The World Health Organization describes COVID as coronavirus disease. COVID-19 is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. At this time, there is no specific vaccine or treatments for COVID-19. Healthy ways to strengthen your immune system by Harvard Health Publishing. Number 1, don't smoke. Number 2, eat a diet high in fruits and vegetables. Number 3, exercise regularly. Number 4, maintain a healthy weight. If you drink alcohol, drink only in moderation. Get adequate sleep. Take steps to avoid infection, such as washing your hands frequently and cooking meats thoroughly. Try to minimize stress. Other ways to prevent COVID from spreading: wash your hands regularly with soap and water or clean them with an alcohol-based hand rub. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and staying away from large groups of people. There are also personal protective equipment that you can wear, and these are things that you should wear outside when you are going in public, say going shopping, for grocery shopping or things like that. You can wear gloves, rubber gloves that I have. You can wear a surgical mask. I have a surgical mask here. You can wear cloth masks that you can make at home. And I even have brought a N95 mask, which protects, it filters out 95% of what you breathe into your nose. So it keeps that, when you breathe out and breathe in, 95% or more of the air is filtered. Some people believe that face masks don't work. And I will be putting up a picture of 3 petri dishes that were coughed into, one with a paper mask, one with a cloth mask, and one without a mask. And the one without the mask is the one with the most growth of bacteria and other things that a person coughed into. So COVID, most of us know that it is spread from person to person. That's the most likely. And it is spread by respiratory droplets produced by when an infected person coughs, sneezes, or talks. And the receiving person is exposed to this and then gets COVID. There is also a possibility where a person would cough, say, into their hand, touch an object or a surface, and someone else would come touch that surface and then touch their faces, etc., their nose, and possibly get that disease also. There are also cases where pets have gotten COVID somehow, and obviously it's from exposure to people. Let's go through some of the symptoms of coronavirus. These are the ones that the CDC has currently. Initially, they didn't have as many, but they have extended and revised the list. So here it is. These are the symptoms you should be watching for every day. Fever or chills, coughing, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headaches, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. So some of my friends that work at the hospital and other hospitals too, I know several healthcare workers, and they have contracted COVID, and I have talked to them about the disease and their symptoms. Some of them have only one or two symptoms, where others will have many, and there are still a couple of healthcare workers that I know that got sick maybe a month ago or so and have still not returned to work. Let me talk about the emergency warning signs of COVID. These are very serious and you should seek medical help right away. Number 1, trouble breathing. Number 2, persistent pain or pressure in the chest. Number 3, new confusion. Number 4, inability to wake up or stay awake. Number 5, bluish lips or face. So what to do if you become sick? Number 1, stay home except to get medical care. Most people with COVID have mild illness and can recover at home without medical care. Do not leave your home except to get medical care. Do not visit public areas. Take care of yourself. Get rest and stay healthy and hydrated. Take over-the-counter medications such as acetaminophen, which is Tylenol, to help you feel better. Maybe you can take cough medicine if you have a cough. Stay in touch with your doctor. Call before you get medical care. Be sure you get care if you have trouble breathing or have any other emergency warning signs that we covered earlier. Avoid public transportation, ride sharing such as Uber or taxi. Separate yourself from other people. As much as possible, stay in a specific room and away from other people and pets in your home. If possible, you should use a separate bathroom. If you need to be around other people or animals in or outside of the home, wear a mask. Monitor your symptoms, and we talked about those symptoms, and also, especially the emergency medical symptoms that we talked about, you should really monitor those carefully. Call ahead before visiting your doctor. Most doctors now can ask you many questions on your cell phone and do an assessment on your cell phone and direct you to the proper caregiver. Avoid sharing personal household items. Do not share dishes, drinking glasses, cups, eating utensils, towels, or bedding with other people in your home. Wash these items thoroughly after using them with soap and water or put in the dishwasher. If you have clothes, wash it and dry it, and that should take care of the cleanliness. So to clean surfaces, you should clean it every day and use some common household cleaners. Here I have some examples. This is Lysol. It says kills viruses, bacteria, mold, and mildew. So it will kill 99.9% of germs. This is a surface cleaner. Actually, it's a disinfector. So once it's clean, you can disinfect it, spray over it, and wait till it dries. When it's dry, it's ready to go. This is the actual cleaner. Antibacterial spray cleaner kills bacteria and viruses. It's spick and span. And you use this, use a paper towel, wipe it. Once that surface dries, it's ready to go. This is Power Foam Bathroom Cleaner. You can spray tubs. You can spray toilets, sinks, and clean that with it. Also, I have Clorox disinfectant wipes. Kills 99.9% of viruses and bacteria. You can use these on your kitchen countertop, tabletop. Wait till it dries. Once it's dry, it's ready to go, and the virus should be dead. So now I will be talking about why is there a recent uptick or surge in coronavirus cases in the US. The states that are most affected are Texas, Florida, Arizona, and California. Those are states where it's quite populated, and also they have opened a lot of restrictions they had. So businesses are opening up again. Places where people socialize, like bars, and other places like restaurants, are opening up. And a recent BBC report titled Coronavirus, What's Behind Alarming New US Outbreaks, basically points at the reason behind the surge in coronavirus cases is directly linked to the opening of all the businesses where a lot of people go to. I know my presentation was rather short today, but hopefully you did learn something from it. The main point is be careful when you are in public. Make sure you wear a mask. And if you are touching things, make sure you wear gloves and clean up regularly, wash your hands regularly, stay away from big crowds as much as possible. And please clean things around you regularly.